hope I'm audible and visible. Can you all give me a quick thumbs up if my audio video is fine? And let's start with today's session of image-based MCQ. It's a very, very important session. Let me just check if my audio video is fine. Yes, very nice. Just give me a quick thumbs up if my audio video is fine, all of you. Yes, good. So I'm Dr. Chesta Aggarwal, your NEET PG educator on Unacademy, that is the best online platform. Now we have two type of subscriptions. One is Plus, which give you an access to Unacademy live classes, and we have Iconic, which give you an access to the Unacademy and the Prep Ladder. Now there's a very important notice for all my students that we have an Unacademy Learning Festival. It's a very important notice for all those who are live in this class that we have launched a 15-day NEET PG subscription for all the students in just rupees 299. So now you can prepare for your NEET PG entrance examination, which is scheduled for 21st of this month. So this is valid only for few days. This live festival or this festival will get live today in the evening. I think after 12 it will be live. So I request all of you to please use my code CHESTA10 and subscribe now. Please use this code and get your subscription today. It's an amazing offer where you can get your 15-day subscription and start your preparation or revision with Unacademy for upcoming NEET PG entrance examination. Other subscriptions which we have is the Unacademy Live, which give you an access to the MCQs. Then we have a NEET PG 2022 All India mock test session. Just a second. Yes. Here on 14th, 9 a.m., you will be having another All India mock test where the All India rank prediction will be given. So please get yourself enrolled. It's a free test. You don't have to pay anything. You just need to enroll and you can use my code to get yourself enrolled. Then we have an FMG high yield batch which will be live on May 11th. We have a UPSC CSC batch which will be live on May 23. And there is a NEET PG practice league with the different subjects. I would be requesting all of you to please get yourself enrolled. You need to use my code CHESTA10. Please use this code to get yourself enrolled. The NEET PG practice league is live here. Now, NEET PG MCQs, you have steps which will help you guide how to go to the NEET PG practice. We have auto daily practice papers after the end of all the plus classes, and we have a separate batch. You can take a separate subscription for UPSC using the code CHESTA10. So these are some of the informations. We have MBBS Prof 1 also with a separate subscription offer. And this is the final list. Kindly use my code CHESTA10. Don't forget my name, Chesta, CHESTA10 to get your subscription. Let's begin with the first question. I hope you all can hear this question. You can see this question. A 38-year-old woman comes to the physician because of a 1-month history of painless, nonpruritic skin lesions on her right thigh. Now, today at 8 p.m., we will be having a session of INI-CT recall. So, I would be requesting all my students to please be live. That will be a premier session somewhere between 8 p.m. to 10 p.m. The recall of dermatology questions for INI-CT 2022. If you have anything in your mind, you can post it on the Telegram group of Unacademy. Anything, any question which you remember, any images which you remember, you can just post it. Please answer this question. A 38-year-old woman comes to the physician with a 1-month history of painless, non-itchy skin lesions on her right thigh. She initially thought it was an insect bite, but it slowly increased in the size over the past week. Her temperature is 36 degrees centigrade, pulses are 75, and blood pressure is 128 plus by 76. You can see that there is a very small hyperpigmented macule. On squeezing it, you see that the skin is retracted. The photograph is shown here. What is the diagnosis? Please remember, nobody has given me the correct answer. It is option number 3. This sign is known as a dimple sign or Fitzpatrick sign, which is very, very classical of dermatofibroma. What happens in dermatofibroma? You have fibrous proliferations. Fibroblasts get proliferated. They release fibrin. And through this fibrin, there is tethering of the epidermis. And because of this tethering or connections of epidermis to the dermis, when you pinch the skin, you will see a depression which is known as dimple sign. Please remember this is very, very important, that is dermatofibroma. Okay, dermatofibroma. Aryan Yadav, I'm not able to understand your question. Please write down what exactly you want to ask. Let's move to the next question. A 24-year-old man comes to the physician for evaluation of a severely pruritic skin rash. A severely pruritic skin rash. What is the correct answer here? The physical examination shows symmetrical rash over his knees, elbow with tense grouped vesicles, severe excoriated marks. Microabscesses in the papillary dermis are seen on the light microscopy. Immunofluorescence shows deposits of IgA at the tip of dermal papilla. Patient skin findings are most likely associated with which of the following condition? Which of the following condition? White dermographism, gladine-dependent hypersensitivity, nail pitting, or positive Nikolsky sign. Very nice. Please remember the correct answer of this question will be option number 2. It's a gladine-dependent hypersensitivity. What exactly is given in the question? This is a patient with dermatitis herpetiformis. In dermatitis herpetiformis, around 90% of the patient has underlying celiac disease where you have gluten sensitive enteropathy. They have IgA antibodies against tissue transglutaminase which go and bind to epidermal transglutaminase causing the grouped vesicles on elbow, knee, upper back or on the buttock. Very, very classical over the dermal papilla. And because of this deposition, when you do an DIF, you will see a granular pattern of deposition. Clear? We see a granular deposits at dermoepidermal junction. Vibhuti, you are right. The drug of choice is Depson for this particular patient. Let's move to the next question. A 54-year-old woman comes to the physician because of painful skin on her right leg for 1 month. It initially started out as a small red spot but has rapidly increased in size during this period. She has Crohn's disease. Examination shows pitting pedal edema of the lower extremities. There is a 4 centimeter tender ulcerative lesion on the anterior right leg with central necrotic base and purplish irregular border. Femoral and pedal pulses are palpable bilaterally. Which of the following is the most likely diagnosis? Which of the following is the most likely diagnosis for this patient's condition? Anyone? Very nice. So this is a patient with a diagnosis of pyoderma gangrenosum. What is pyoderma gangrenosum? It's a neutrophilic dermatosis where neutrophils get deposited inside the skin. It's a neutrophilic dermatosis where the neutrophils get deposited inside the skin. Now, what happens here? What happens? Because initially there is a neutrophil, it causes local inflammation, which causes papule, nodule, and ulceration. Now, because it is due to neutrophil, antibiotics or sterile condition will not play any role. You need to give a drug which is steroid, or you may even give Depson, which work very well here. So please remember, it's a very classical case of pyoderma gangrenosum. Can anybody tell me what is ecthyma gangrenosum and what is the causative agent for ecthyma gangrenosum? Anybody can tell me the answer here? Excessive sweating of hand and feet. Aryan, there are multiple causes for hyperhidrosis. You cannot, without any investigation or proper workup, you cannot comment on the cause of hyperhidrosis. As such, we do not have any drug. We give a lot of topical formulations for like aluminum chloride containing formulation to take care of palmoplantar sweating. We even give topical or oral glycopyrrolate, but still there is no complete relief with these therapies. You need to go for a complete evaluation for hyperhidrosis. Okay. The answer of ecthyma gangrenosum causative agent is pseudomonas. Please remember the answer is pseudomonas. Very nice, Sujit, Ashima, GK, and Rajeshwar. The next question is on your screen. I request all of you to please take Unacademy subscription of 15 days using my code CHESTA10. You can get the 15-day subscription in just rupees 299. It's a very cheap subscription which will be very helpful for you. And this offer will be live by tonight. So please get your subscriptions today. Now, this is a very classical example of plantar wart. A 16-year-old boy comes to the physician because of a painful lesion on the sole of his right foot since 1 month. So, this is a painful region which is present on the undersurface of the foot. It has become progressively larger and more painful, making it difficult for him to walk. He does not have any personal or family history of serious illness. Examination shows a 1 centimeter lesion on the sole of the foot. The remainder is unremarkable. What is the correct answer? Very classical example of, I'm very sorry, not this one. Human papilloma virus. Human papilloma virus. HPV 1 is for HPV 3 and 10 is the answer. HPV 3 and 10 for the plain wart, and HPV 1 is for the plantar wart. HPV 1 is for plantar wart. HPV 3 and 10 is for plain wart, and HPV 2 is for common wart, for the common. So the correct answer is option number 3. Okay. The next question is on your screen. A 48-year-old man comes to the physician because of a hypopigmented skin lesion on his finger. He first noticed it 4 weeks ago after cutting his finger with a knife while preparing the food. He did not feel the cut. His temperature is 38.7 degrees centigrade. Physical examination shows a small healing laceration on the dorsal aspect of the index finger and an overlying well-defined hypopigmented macule with the raised borders. Sensation to pinprick and light touch was decreased. Which of the following is the most likely causal pathogen for this patient's condition? Which is the answer here? Amazing. Very nice, all of you. Very nice. The correct answer of this question is Mycobacterium leprae. The correct answer of this question is Mycobacterium leprae because the loss of sensation over the plaque, it's a very classical infection of M. leprae, that is leprosy. Very, very important question. M. leprae, that is leprosy, causes this particular type of lesion. Now, next question is on your computer screen. What is the correct answer here? You are called in the emergency department for an infant who developed skin exfoliation. Mother gives a history of fever and an irritable child. The vitals are normal. What is the correct answer here? Anyone can give me the answer to this question? Very nice. So actually this will not be an infant. This is a child who presented with a very classical exfoliation on the skin. Can you see a very classical exfoliation? Peeling of skin. Superficial skins are peeling off. This is a very classical example of Staphylococcus scarlet skin syndrome, where Staphylococcus releases an exfoliative toxin which binds the desmoglein 1. And when it's bind to desmoglein 1, it causes superficial exfoliation of the skin. Now you have another question. A 28-year-old girl has asymptomatic lesion on her forehead and on the genitals for last 2 months. She gave a history of unprotected sexual intercourse few days back. Which of the following would be the causative agent? Vibhuti, Rameshwar, Rinku, Combat. Look at this. Look at the lesions. There are multiple dome-shaped lesions. They are not vesicles. You can see multiple discrete dome-shaped lesions. They are asymptomatic. Please remember, in herpes, you see grouped vesicles with complaints of burning and pain. Plus, you will not get the lesions of herpes on the forehead. Will you get the lesions of herpes on the forehead? No. This is a very classical example of molluscum. This is a very classical example of molluscum contagiosum. And please remember, molluscum contagiosum lesions, they are discrete, they are asymptomatic, they are dome-shaped with a central umbilication. So this is a correct answer, option number 1, that is the pox virus. Very nice, Aditi, Ashima, Vibhuti and Dr. Balu. 10-year-old boy with a painful bogey swelling of the scalp, multiple sinuses with purulent discharge, easily pluckability of the hair, lymph node were enlarged. Which of the following would be most helpful for diagnostic evaluation? What is the correct answer? I hope the image is visible. Biopsy, bacterial culture, KOH mount, or a patch test. Which test you would prefer doing in this particular patient? The correct answer of this question is KOH mount. This is a very classical image of what is called as chirion. Can you see this? There is a scalp with loss of hair, patchy hair loss, matting of the hair, pus-filled lesions, sinus tracts in a young or a prepubertal individual gives you an idea that you are dealing with tinea capitis, non-inflammatory type, which is known as chirion. Tinea capitis inflammatory type, which is known as chirion. Clear? So this is very important. Tinea capitis inflammatory type, which is known as chirion. Is this clear to everyone? Can I get a quick thumbs up? A 37-year-old male patient develops purple red macule after taking metronidazole. History of similar lesions at the same site 6 months back. What is your diagnosis? Anurag, Aditi, Swati, Kapil, Gopi, Rinku, Yogi, Rameshwar. A 53-year-old male with purple red oval macule after taking metronidazole. Very nice. Classical image, classical example. Do not think anything when you get this image. It's a fixed drug eruption. Whenever patients take the culprit drug, he develops the lesion on the same site and there will be healing with hyperpigmentation. So you can identify what was that site by looking at the pigmentation. Next question. A female with hyperpigmented patch with hairs on her lower body since birth. What can be the diagnosis? If you want me to show this in a very zoomed manner, look at this. This female lower body, just below the umbilicus and the proximal part of the lower limbs, that is thigh, hyperpigmented patch is seen with hypertrichosis. You have hyperpigmentation with hypertrichosis, hyperpigmentation with hypertrichosis. What will be the answer? Hyperpigmentation with hypertrichosis, what will be the answer? Please remember, the correct answer of this question will be congenital melanocytic nevus, a giant variety. Giant congenital melanocytic nevus, which is pre-malignant condition. Please remember, it's a pre-malignant condition. Size more than 20 centimeter and it is associated with increased hair. All these features are very, very classical of congenital melanocytic nevus of a giant variety. Now, eczemas which can lead to these conditions are all except atopic eczema, seborrheic dermatitis, phytophotodermatitis, or nummular eczema. What is the answer? First, identify what exactly is happening in this patient. What is this a patient of? Very nice. This is a patient with erythroderma or exfoliative dermatitis. This is an image of a patient with exfoliative dermatitis. It's a patient with exfoliative dermatitis. It's a patient with exfoliative dermatitis and atopic dermatitis, seborrheic dermatitis, and phytophoto. All of them can proceed to this stage, but nummular eczema will never form. It's a localized variety. It can never It's a localized variety. It can never convert into the exfoliative form. Okay, so amalgamate, Nisha, Kapil, Swati, Damu, Ashima. I hope everybody is clear with this question. The next question, let me just move it little below so that it becomes more visible to you. Yes. Ulcer with overhanging undermined edges in the neck region, as shown in the image given below. What can be your diagnosis? Very nice. Tubercular lymph nodes, malignant cervical lymphadenopathy, syphilis, or reactive lymphadenopathy. Again, I'm repeating all my students that the Unacademy have launched a 15-day subscription, which you can use or which you can take by using this code CHESTA. The code is CHESTA10. This will give you an access to 15-day Unacademy subscription. So please take this subscription today. Okay. Okay. The answer to this question is option number one, that is tubercular lymph node. The answer to this question is option number one, that is tubercular lymph node. Let's move to the next question. A previously healthy 30-year-old man comes to the physician because of a 2-week history of skin lesion on his elbow and the back. He had no history of serious illness. He takes no medication, and physical examination shows bilateral elbows, back, and scalp with these lesions. What is the answer? We have discussed this already. Can you tell me the diagnosis? Rameshwar, Amalgaman, Combat, Rinku. What is the diagnosis here? What is the correct answer of this question? Very nice. A previously healthy 30-year-old man who comes to the physician because of a 2-week history of skin lesion on his elbow, back, no history of serious illness, takes no medication, very, very classical of psoriasis. Erythematous plaque with silvery white scales, very, very classical of psoriasis. And please remember, for psoriasis you need to give calcipotriol. For psoriasis you need to give calcipotriol. Okay, clear? Can I get a thumbs up from all my students? Okay, calcipotriol is a vitamin D analog, which is a topical drug which is used in psoriasis. Next question. 35-year-old woman comes to the emergency department because of a 1 week or a 1 day history of fever, malaise, sore throat. She had a urinary tract infection 2 weeks ago that was treated with trimethoprim or sulfamethoxazole. There is ingestion of conjunctiva, purulent discharge. Oral and pelvic examination shows erythemas of the mucous membrane. And we also see some vesicles, which is tender erythematous macule with the purpuric centers. When the skin is slightly stroked, the superficial layers of the adjacent skin separate. Which of the following is the most likely diagnosis? Very nice. Vibhuti, Shekart, Dr. Yogi, Aditi. Anyone can tell me the answer? Dr. Kapil, Amalgamate, Combat. This is a patient with toxic epidermal necrolysis, which is a form of drug rash. In these individuals, you develop targetoid lesions, which are nothing but a vesicle or a necrotic area or a purpuric center with redness surrounding it. It is present in more than 30% of the body surface area. We have involvement of mucosa, which can be oral mucosa, genital mucosa, even conjunctiva. So that is the presentation in these individuals. Okay, that is the presentations in these individuals. Next question. Yes, you're right. It is known as Lyle's disease. Very nice, Akhil. Anybody can tell me the correct answer. A 26 or 28-year-old woman comes to the physician because of a 2-month history of multiple right inflammatory lump. There are tender, foul-smelling odor. She has had previous episodes of painful swelling in the axilla 12 months ago that resolved with antibiotic therapy, leaving some scar. Examination of the right inframammary fold shows multiple tender erythematous nodules and fistula with purulent discharge. Which of the following is the correct answer? Very nice. This is a patient with hidradenitis suppurativa. Hidradenitis suppurativa. And here the apocrine glands are not functioning properly, and that is why the sites like axilla, areola, and groin are most frequently involved. Now let's move to the few more image-based questions. The alcoholic with history of diarrhea and delirium, what can be the diagnosis? Only 4 minutes are left for the session. Alcoholic with history of diarrhea and delirium, the diagnosis: niacin deficiency, zinc deficiency, selenium deficiency, or riboflavin deficiency. What is your answer? Yes, this is a patient with very classical pellagra. You can see the characteristic photodermatitic lesions. In addition, the patients have diarrhea, delirium, and it occurs in alcoholic because the consumption of niacin or tryptophan is very less in these individuals. Next question. Please tell me the correct answer of this question. Very nice. Kaposi varioliform eruption is varicella-like grouped vesicle lesions in Kaposi sarcoma, infection with herpes virus in patients with atopic dermatitis, which may result in spread of herpes simplex throughout the eczematous areas, infection with HHV8 resulting in a cutaneous exanthem distributed centripetally, and maculopapular rash due to cutaneous hypersensitivity following Kaposi sarcoma viral infection. The correct answer of this question will be option number 2. Kaposi varioliform eruption is also known as eczema herpeticum. It has nothing to do with Kaposi sarcoma. Please remember, it is a misnomer. It has nothing to do with HHV8. It is a condition, eczema herpeticum. It's a condition which is seen in the patients with atopic dermatitis. Now, what is the main problem in atopic dermatitis patients? These patients have defective barrier. The atopic dermatitis patients have defective barrier. So when the barriers are defective, the herpes infections, which are usually localized to mucocutaneous junction, they become more widespread. They tend to spread on these areas where there is underlying eczema, and this is known as Kaposi varioliform eruptions. Okay, because of defective barrier function, these lesions goes little down. So with this, we are done with the today's session. I hope you all have enjoyed. So thank you all of you for this particular session. Please use this code CHESTA10 for your subscription. And I just want to discuss this slide again, that Unacademy have launched a 15-day NEET PG Unacademy Plus subscription only in rupees 300, 299, only in rupees 300. You might be asked a code, and the code is CHESTA10. Please use this code. Please use this code to unlock this offer, the amazing offer which is given. The next session will be tomorrow, same time, that is 2:30 p.m. I'm very sorry that today's session got a little postponed. So the next session will be tomorrow 2:30 p.m. or maybe day after tomorrow 2:30 p.m. You can press the bell icon so that you get all the notifications of my classes. Thank you all of you. Good day.